Hello dear Medico student, welcome our YouTube channel Exploring Medico. I will be teaching you a joint. Today we will discuss about the mechanism of lubrication, limitation of movement, types of bursa and its clinical anatomy. Please like the video and subscribe the channel and watch entire series of joint. So let's start with the mechanism of lubrication. First is synovial fluid, which is secreted by synovial membrane. It is sticky and viscous due to hyaluronic acid. It serves the main function of lubrication of the joint. It also nourishes the articular cartilage. Second is hyaline cartilage. Covering the articular surfaces possesses inherent slipperiness like that of the ice. Third is intra-articular fibrocartilages, articular disc or MENSC, complete or incomplete, which help in spreading the synovial fluid throughout the joint cavity, but particularly between the articular surfaces. Example for temporomandibular joint. The disc divides the joint into two cavities for diverse movement in two cavities, and the disc strengthens the joint. Fourth is Haversian fatty pads, which occupy extra spaces in the joint cavity between the incongruous body surfaces. All of them are covered with synovial membrane and perhaps function as webs to spread the synovial fluid. And fifth is bursa. It is a bag-like space lined by synovial membrane containing synovial fluid. The digital synovial sheath in the relation to tendons, joint and bones to prevent friction. The tendon are supplied by blood through vincula brevia and vincula longa. The inflammation of bursa is called bursitis. Bursa reduces friction and permits limited free movements, and which we can see in the diagram, vincula longa and vincula brevia. And in the right side we can see the bursa in relation to knee joint. Next is limitation of movement. There are some factors in which reflect contraction of antagonistic muscle due to stimulation of mechanoreceptor in articular tissue. Ligaments get taut, approximation of soft parts. Next is types of bursa. There are three types of bursa, in which first is subcutaneous bursa, second articular bursa, and third subcutaneous bursa. First, subcutaneous bursa. These are present between bony prominence and skin. Example is prepatellar bursa and subcutaneous infrapatellar bursa. Second is articular bursa. This bursa friction at a joint. Example for bursa between dens of axis and transverse ligament of atlas vertebra. Third is subcutaneous bursa. These are present between bone and tendon. Example for supraspinatus bursa between bone and ligament. So let's see the clinical anatomy. Intervertebral disc forms secondary cartilaginous joint between the bodies of the vertebra. If the nucleus pulposus part of the disc protrudes backward, it may press on the spinal nerve, leaving out from the intervertebral foramina. The condition is known as herniation of the disc or disc prolapse. If disc prolapse occurs in lumbar vertebra, there is radiating pain in the lower limb, and the condition is called sciatica, which we can see in the diagram, the herniation of the disc. The joint may get dislocated, that is, the end of the bones get out of its socket, In subluxation, the end of the bone partially leave its socket. Rheumatoid fever causes fleeting pain in the joints accompanied by streptococcal pharyngitis. It is mostly temporary pain in the joint, and the toxins of the bacteria may affect mitral valve of the heart or the kidneys. We can see in the diagram A is dislocation and B is subluxation. Rheumatoid arthritis is an inflammatory systemic disease resulting in thickened synovial membranes of the small joint of the hand. Due to chronic inflammatory process, there is the erosion of bones leading to deformity of the fingers. In the diagram A, synovial membrane in a normal joint and B, thickened in rheumatoid arthritis patient. And next figure, A is joint of hand in normal subject and B in rheumatoid arthritis hand. Osteoarthritis is a degenerative condition of the large weight bearing joints. The articular cartilage wears out, degenerates, and there is formation of peripheral osteophytes. The patient feels lots of pain due to rubbing of the bones together during movement of the joint. We can see in the right side of this slide, A is knee joint of a normal subject and B a osteoarthritis knee joint. So that is all about the joints. So next topic of anatomy will be discussed in upcoming video. Stay tuned. Follow entire series of joint. Thank you.